Hi everyone, Dr. Nemechek here. I wanted to discuss a case we have, very interesting, of a young lady with rather severe POTS, uh, postural orthostatic tachycardia syndrome. Uh, she was trying to go to college. She could barely uh, get through a class. It was very, very difficult. So we started on our basic protocol of fish oil and olive oil, twice a day rifaximin, and a vagus nerve stimulator. And we had some improvements. I mean, she was able to do better in class and things like that. She still had a lot of accommodation issues that she needed to get through all of that, but improved, but far stretch from being able to function, say, in a full-time job. And so then, and she had acquired COVID quite a while ago, early in the pandemic. And as I've talked about in the other videos, the COVID causes this unique form of leaky gut. Now, when you have bacterial overgrowth or SIBO, you have these cells together and you get leak between the cells, okay? And that'll trigger inflammation. What happens with COVID is they've shown that in some people, not everybody, but in some people, clusters of cells will die, and it leaves you with a relatively massive hole from a molecular viewpoint for stuff to flow into the body and trigger inflammation. And the glutamine can help that part. So we had her on rifaximin to treat the bacteria for the leaky part like that. And we didn't know this was happening in COVID till late last spring with some new data that was published. We started her on glutamine, and in about 6 months, she's now close to normal. She can do a lot. She drove, her parents moved, she drove all the way across the country by herself on a car, just sitting there still, regulating blood pressure, all that. Impossible before. Okay? So this girl had two forms of leaky gut. That from bacteria, which was very common prior to pandemic, and now from a glutamine deficiency state created by COVID and the high inflammation, and that is responding very nicely with her to glutamine. And so we use a level tablespoon twice a day for that. So hope that's helpful to you all. Everybody have a good day.